Pregnancy and hydrocephalus, at the conventions they have every other year, there's a whole section just on that, from parents who are worried about their little girls as they get older. What will their future be like? Can they have children? Should they have children with this condition? For me, my husband and I got married. So my last surgery was October 2003 when they poked the hole at the base of the brain. And we got married July 04. And we had our first child May 06. And it wasn't a, oops, we got pregnant. Okay, let's have a kid. Let's do this. It was, okay, before we get pregnant, let's meet with a neurosurgeon to make sure the brain is looking okay, because we don't want brain surgery in this 9 months. Let's meet with an OBGYN who thinks they can handle my pregnancies. It was very thought out before we could even think about getting pregnant. It had to be, we just had to check all the bases. And then during the pregnancy, it was a normal pregnancy, barfing for 4 months, and that would spike headaches, which would kind of make us all wonder, but after the intensity of the throwing up calmed down, the headache would calm down as well. So we were okay until the end of the pregnancy. When I went, just before I went into labor, I got this horrible headache that just would not go away. And that is what took me to the hospital, not the labor pains, which were consistent, but not close enough to warrant going to a hospital. But I went, I'm like, I've already called my neurosurgeon. He told me to come in. And I remember the nurses saying, you aren't far along enough. Like, there's not much we can do for you until it gets closer. The contractions get closer together and you're not dilated hardly at all. So you need to go home. And I kept saying, no, I'm not here. Yeah, I'm going into labor and the baby will come in the next few days. I get that. My head is killing me. I'm like, I could barely talk, and my husband had to translate most everything because I just couldn't communicate through the pain. It was so bad. And they eventually got the message, oh, she has brain issues. Maybe we should keep her here. And then during the delivery process, my OBGYN wanted me not to have to push at all, especially with the headache. I don't know that I could have without killing myself. But when you push, when you bear down, that increases your intracranial pressure because your ICP. You're pushing, ICPs going up, and with the patient with hydrocephalus, not a good idea. So he allowed the baby to drop as far as possible, helped her out any way he could, and it worked out beautifully that I didn't have to push. But the second she was born, headache was gone. And we didn't know why. We're like, well, it's probably related to the hydrocephalus. But it was 4 deliveries later that we finally saw, okay, just as soon as I go into labor, my headache spikes and it goes away as soon as baby is born. It's got to be the hydrocephalus at some point. And the physics of all of it is interesting. I didn't have a shunt during my pregnancies, so pregnancy with a shunt can be very different. Pregnancy with a shunt looks like, the catheter goes to your abdomen usually, sometimes your heart, but usually the abdomen, your peritoneal cavity. It is right under the skin. So as your skin expands in your pregnancy, that catheter is right there and it could become clogged. It can, maybe if it's not long enough, it could break. It could stretch and pull the whole shunt system down and it's very tight and uncomfortable, I'm assuming, and from what I've heard. But for the most part, the biggest thing is the delivery. How do you get the baby out? If you push, it increases ICP. The shunt will only open at 1 pressure. So it'll most likely open, but that might not be enough because if the pressure, this is where the physics, I was a history major for a reason, because the physics always confused me a little bit. But from what I understand, differential pressure, the fluid will go where the pressure is the least. So if your pressure is high in the belly and in where the end of the catheter is, but lower in the brain, even though it's still pretty high from pushing or whatever, the fluid is going to back up into the brain probably, or just not drain at all. It's not going to drain because the pressure's too high down yonder. So after, in my pregnancies, even without a shunt, as soon as I delivered the baby, my body was able to drain fluid, excess blood or spinal fluid, whatever it is in the brain. And for those with shunts, I'm sure it's very similar. As soon as baby is born, there's less pressure in the abdomen, and fluid is able to drain more easily to where there's less pressure. Differential pressure physics. Someone will have to Google it because I sure did. Even then, had my husband explain the dynamics of it all. But it makes sense. So with pregnancy, the biggest concern is delivery, I would think. Some women just elect to have a C-section, which is fine. The C-sections, I think, raise a few neurosurgeons' eyebrows because that could introduce infection into the abdomen in some way. But especially that shunt catheter, if there is an infection in the abdomen, you have to assume the shunt catheter is infected. And if that's infected, it could spread to the brain and cause infection in the brain or meningitis and swelling and all sorts of drama. So some women elect to do the C-section, and that's fine. And we just hope and pray that no infection happens. And I'm sure it rarely ever does. But some of us elect to have a natural birth, and it worked out for us, literally, for 4 children, and the headache went away the second they were born, and they were all born just fine. I never had to push. I was just blessed in that way. No, I think with my last one, I did have to push. And the doctor, I'm like, am I pushing? I can't tell because I had an epidural. Like, I can't feel anything. And even though this is my 4th kid, I've just never had to do this. And I remember him laughing at me. He's like, if you're talking, you're not pushing. Hush. Like, help me out a little. Let's get this kid out. But it all worked out. But it's definitely a conversation that has to be had between the patient and not just the OBGYN, but the neurosurgeons as well. And even my insurance, they required an MRI before they can induce. I think my last 2, I had to be induced because the headache was just so bad and I was barfing. I'm like, this is not, there's a reason why we have morning sickness at the beginning, because I cannot lean over a toilet and barf anymore. That's just not possible. But this headache, the everything. But before they'd allow me to be induced at 38 weeks and 6 days, insurance required an MRI, which is 45 minutes laying flat on your back, super pregnant, and the most uncomfortable thing ever, and you could barely breathe. But yeah, sure, we'll get this MRI for, black tape or red tape and to cross the I's and dot the T's, or it just got crazy that they required it. It's like, how are you my doctor? Like, why would you trump a neurosurgeon and OBGYN saying, yes, the most safe thing to do right now is induce this woman so the headache will go away? But that's what they did. So yeah.